Hello, this is part 2 of skin assessment for myofascial health. In the first video we went over body scan, stretching and range of motion, as well as skin pinching to assess the condition of our fascia. In this video I'm going to quickly go over looking a little more deeply at the skin and the quality and condition of the skin to assess the condition of the fascia underneath. Alright, so one of the first things we want to look at is the color of our skin, and not whether it's brown or white or yellow or red, but does it have a good color to it? Does it look like it's nourished? Is it, nice and pink or a nice rich color, or is it kind of ashy or pale looking? We want to look and see if there's any big moles or, weird looking spots, anything like that. And if so, we want to keep an eye on them and ideally have a primary healthcare provider look at them. But we can also use those to get an idea of where things aren't moving enough. And often when there is, a discoloration or a rash or something out of the ordinary, that will mean that something isn't moving appropriately in that area. And one of the areas that I really focus on with my clients is skincare, because it is such an important indicator of what's going on inside of our body. So note anything that you see when you do that assessment. And if you find something out of the ordinary, please talk to your healthcare provider or contact me, and I can help you make sure that anything that needs to get looked at or taken care of does. The next thing that we can do is notice any areas of sagging. So oftentimes as we age, the underarms here will start to sag, or they'll get built up and be really chunky. And they often go hand in hand, because when our fascia builds up in an effort to protect weakness, it cuts off circulation to the area and it compresses the muscle tissue underneath. So everything starts to dry out and the skin will start to hang, but it'll hang in this chunky way. Sometimes it'll be like a flap, and that can happen more as we get old and the skin isn't getting nourished. But when it just starts out, it'll just be, it just doesn't look as good as we want it to. Sometimes on the back of the arm we'll have a little dimpling or cottage cheese effect, and that's a sign that there's just some fat trapped under the bound down fascia. In that case, we learn what are the things that we can do to work with that. Cupping is great, blasting is great, pinching and rolling is great, making sure our nutrition is good, taking the herbs that we need to support that. So again, we're looking at the quality and condition of the skin. So sagging, if there is any dimpling, we want to note that. Any big, reddish spots or discolorations. And we can look down the entire line of the pathways into our armpit, looking everywhere just to make sure that we know what's going on. Oftentimes in the chest with women, we'll have our breasts start to sag, so that's a sign that we're having some fascial buildup in the chest, preventing the skin from keeping its tone, and likely the muscle from keeping its tone as well. The muscle may either just be backed up and not be able to function effectively, or it may be weak, oftentimes both. So there's a lot that we can look at when we're assessing the quality of our skin and our fascial tissues. In assessing the quality of our muscles, it really becomes about the ability to contract and release fully with control when we want it to. So muscle that's in spasm is contracting uncontrollably and cannot release. A muscle that is weak, we may not even be able to contract it very much. A muscle that's blocked or dehydrated, we can sometimes get a contraction and it'll get stuck in spasm, or we can contract and we'll start to feel pain because those nerves are so disorganized, or we just might not be able to do anything with it at all. So we learn in the process of healing not only to break up these blockages, but then to rehydrate and renourish and rhythmically shift those blockages out of the muscles so we can get it to a deeper layer And then we can begin to deeply heal the nervous system that runs through the deepest parts of our body. We can access that by healing from the outside in. All right, I hope that was helpful. Let me know if you have any questions. I've got lots of videos coming out, so stay tuned. If you want to get going on this process yourself, drop me a line and I'm happy to get you started.